promote technical consultants even after they leave the house. I'm happy to report this. So these many years from now, when you still need help, she'll still be there.
She'll still, that, you know, that is truly my hope. Just during this whole, as I was writing words and just trying to get my thoughts together and just being mindful and just centering, so I'll say the right words. She was there in my ear. Bullet points, no sentences, bullet points. You're not writing a paper. Please don't feel like we have to rush. I know the flyer says 6:30. I'm mindful, you know, people getting home, and just if we can give them 5 or 10 minutes, I really want to be flexible and just allow people the opportunity, if you don't mind.
Right. We'll give it another couple of minutes, and then I'll introduce you. And of course, it'll still be open then.
Okay.
We are also, I'll say this again, we're live streaming on Facebook. But there is a lag between the Zoom meeting and the Facebook of 40 to 45 seconds. Now, that won't apply to any of us who are here, but if anybody's listening on Facebook, just so you know that. And of course, they won't be hearing that as I'm saying it because there's a lag. We need our Pat. She must be having
She might
trouble.
be watching on the live stream. There's 5 people watching the live stream right now.
Oh, okay.
So
That's
she might
true
be in
too.
there.
Okay. Okay, I am live, is that right? So folks can hear me?
Yes.
Okay. I'm going to go ahead and get us started, and we'll just see as people come in. So this is the spring series for our mind stretchers at St. John's, January, February, and March. And Pat Clark and Kenneth and I came up with this theme of after the apocalypse. And the idea was to take a snapshot of the state of Arkansas just after this last year and everything we've been through. We're extremely honored tonight to be joined by LaShannon Spencer, who is the CEO of Community Health Centers of Arkansas since 2016. She'll say a little bit more about her bio, but she comes to us with a background in hospital operations, public policy, advocacy, patient and physician relations, safety, quality, and her goal is healthcare services for vulnerable populations. It's actually that theme that caught my attention. LaShannon was a guest on the Arkansas PBS News show, Arkansas Week, and I was just struck by the comprehensiveness of her view of the vulnerable populations in Arkansas. A little bragging point, which I'll do for her, which is she has been named by Arkansas Money and Politics. Is it the 20 most influential power women? Is that the right grouping?
That is the correct grouping. Yes, sir, it is.
2020. So on that note, could we let's see, the way we'll do this, I believe, is that Kenneth will mute us. Well, Kenneth is our Zoom meeting sort of webmaster, and he will mute us while LaShannon is speaking. We'll have an opportunity for discussion after she speaks, and you can submit your questions by chat, or you can unmute yourself and ask a question, and we'll just try to sort of juggle and make sure we're not talking over each other. And then on Facebook, you can submit a question as well. Kenneth will be picking those up, although there'll be obviously a little bit of a lag time till your question gets picked up. So on that, with those sort of procedural things, LaShannon, may I turn it over to you?
Yes, and thank you so very much. Am I getting an echo? Is that me? Is that better?
Yes.
Okay, perfect. Let me just thank St. John Episcopal Church and also Miss Pat. I don't see Miss Pat here, but Miss Pat, thank you so very much. You are truly a jewel, and just calling and just making sure that I was available for such presentation. I bring you greetings from Little Rock. I am LaShannon Spencer, the Chief Executive Officer for Community Health Centers of Arkansas. And Mr. Jeffrey, he explained that he had saw me on a PBS show and just talking about health and the state of health. But I was very fortunate that he reached out as well, along with Ms. Pat, to grant me the opportunity tonight. And as I think about the mind stretchers and just this special series, COVID-19 and where we are right now, and the intersection of faith and science. And there are some that may think, well, faith and science doesn't necessarily go together, but I am one that believe that the Bible, just like all of us being students, the Bible has prepared us. And the Bible being a book that we study, it's preparation. So throughout the Bible mentions faith and science together. So tonight, this presentation pertaining to COVID-19, you will often hear me make reference to scripture and just how the interconnectivity of faith and science. Just a little bio about me. As I was telling Mr. Jeffries earlier, and he actually heard her in the background, I have a 5th grader at Episcopal Collegiate School. She is my IT person. She's actually my mother sometimes. She helps to drive me. And as I was actually putting this presentation together, she said, Mom, you're not writing a paper for one of the articles that's going to be published. It's actually a PowerPoint presentation, so you need bullet points. So this presentation, you may see long sentences or paragraphs, but I'm just trying to make sure you really understand the meaning and the message that I am trying to relay. Who am I? I am a Christian more than anything. I am a servant, and I'm very passionate about healthcare. I'm ensuring that everyone has access to quality healthcare services, regardless of your background. And when I say that, regardless of where you live, your social economics, your gender, your race, just quality. And there is definitely a difference. And I tend to live by, I can do all things through Christ that strengthens me. And as I make decisions each and every day in the workplace and as I lead, I lean on his everlasting understanding. And I'm a believer in the prayer of Jabez. And I constantly ask God to enlarge my territory to be an advocate for all. Born and raised in Little Rock, I've lived on the West Coast. I attended undergraduate in Columbia, Missouri, Stevens College, and all women's college. Then I returned back here home, received my first master's from the University of Arkansas at Little Rock in public policy, my second master's in healthcare administration. I am all but defended a doctoral degree from University of Nevada, Las Vegas. While I was working for a hospital system there, I was actually in school at night. Here's just a picture of my daughter. She is truly my rock, and COVID-19 has really impacted me being able to go and actually enjoy chapel with her on Wednesdays at Episcopal. So I really miss being able to be there in her school building, just fellowshipping and just being next to her side, listening to the word. Today, we reached 400,000 deaths in the US because of COVID-19. And I just thought, when we all see that number, we must understand Psalms 46. And Psalms 46, God is our refuge and our strength, a very present help in times of trouble. Therefore, we should not fear. And we should not fear. And people that are here that are listening to this presentation, instead of being fearful, have faith and trust in God. And so I just thought it was just very important to just be able to, there are 400,000 deaths, but do not be of fear. Also, just scriptures to ponder on as we go through this. Just the book of Psalms, Psalms 57, be merciful to me, O God, be merciful to me, for my soul takes refuge. Proverbs 3, 25 through 36. Have no fear of sudden disasters. The Bible speaks about the disasters. COVID-19 is just a different form of disaster. And again, Psalms 46, 1 through 2, just the strength, the ever-present in trouble. Isaiah 43, 2, when you pass through the waters, I will be with you. When you pass through the rivers, they will not sweep over you. When you walk through the fire, you will not be burned. The flames will not set you ablaze. Psalms 91 and 2, I say of the Lord, he is my refuge and my fortress, my God whom I trust. When various outbreaks of disease and natural disasters occur, we as humans, we often ask God, why? Why pandemic? Why diseases? Why such illnesses? And then we often think about the end of times. But again, the Bible, particularly in Old Testament, describes numerous occasions when God brought about plagues and diseases on his people and on his enemy to make us see his power, so we can overcome where we are today. And I'm a believer in Einstein, a quote. And one of the quotes that I like to think about as I think about science and just religion, it's science without religion is lame. Religion without science is blind. Science without religion is lame. Religion without science is blind. They both go hand in hand. There's that correlation that in the beginning, when God created the earth, there was science as being a part of religion. As Mr. Jeffrey said, I am the CEO for Community Health Centers of Arkansas. In the state of Arkansas, there are 12 federally qualified health centers. And in 2020, Community Health Centers, also known as federally qualified, served over 300,000 patients. And right there in your Fort Smith area, there is River Valley Primary Care Services that is up under the umbrella of Community Health Centers of Arkansas. And the mission of Community Health Centers of Arkansas is to be an innovative leader, actually promoting improve health outcomes, and equal access to the highest quality care for all Arkansans. And through our mission is to advocate for and to facilitate the success of health centers to promote access to all Arkansans. Here's a map of all the health centers here in the state. And so there are health centers across the state with over 135 sites. Now, as we get into really the meat of the presentation, there are 4 points or just thoughts that we will ponder about as I talk about and will be engaged in conversation. COVID-19, faith and science. One, the impact of COVID pandemic in Arkansas, how it's impacted marginalized populations, whether it's rural communities that are cut from healthcare or essential workers and often people of color, and public health. And what is public health? And the response to COVID-19 and the challenges with vaccine distribution and the need to promote trust and acceptance. A little bit history about community health centers. It was 1965, and the man that you see to the right is Dr. Jack Geiger. He is actually the founder of community health centers. Community health centers actually started within the Delta part, Mount Bio, Mississippi. The first health center in the state of Arkansas was over in the Delta, was in Lee County Cooperative Clinic, and it still exists today. My life changed March 13th. That's when the first COVID case actually hit. That's when started receiving multiple phone calls about the first COVID patient in Pine Bluff, Arkansas, that was at Jefferson Regional Hospital. Here on May, sorry about that, in mid-May, May 13th, I made a promise to the governor that within 60 days, 30 days, we would have over 60,000 people tested. Well, I'm here to say within 30 days, we had over 95,000 people tested across the state. And so since then, just been very closely with the governor pertaining to COVID-19, people at the Arkansas Department of Health when it comes to the vaccine distribution, and just really trying to educate the masses about the importance of practicing social distancing and just proper hand hygiene, and just making sure you're very cognitive of your environment and people that you're around that could potentially have tested positive or positive. And I pause here for a moment because May 13th, every month, I may have written an article, and that was in the Dem Gazette or other small newspapers across the state. It was 2 weeks prior to the start of school. I wrote an editorial that was published in the Democrat Gazette, being mindful of how we need to protect our grandparents from their grandchildren testing positive, because kids are asymptomatic. This was July, early August when that editorial actually ran. And I have to say, I work around people that are that have tested positive. I remain negative, but I'll never forget, I was advocating and trying to tell people the importance of ensuring that grandparents remain negative. My father picks up the grandkids from school. There are 3 grandkids, he's retired. And so that is his hobby, is actually pick up one grandchild from Holy Souls and then the other 2 from Episcopal Collegiate. It was December 18th. My father tested positive. The 3 grandchildren tested positive. And here I am advocating and articulating the reason why grandparents need to stay away, not thinking we wore masks. We did not get together for Thanksgiving. We have remained socially distanced because on Sundays, that's when we would gather together as a family and have dinner. Due to COVID, when COVID started, we eliminated and everyone basically stayed in their house. But COVID, as I sit here and do this presentation, COVID has impacted me, my family, but I have not tested positive for COVID. It is my belief that maybe last winter, I may have had COVID, but right now I still remain negative. But my daughter, asymptomatic, she did not have any symptoms, no fever, no signs of being positive, but it happens. And so for those grandparents that are watching, please be mindful that your grandchildren potentially, because of being asymptomatic, they could be positive. And so I just want to ensure that you know that. And through this and using me as a testimony to be able to share with you, we took every single measure to ensure that a family was safe, but it just happened. You know, so what do we know about COVID-19? There have some unforeseen challenges has caused this to take a toll on people across the world. Many countries and states have declared restrictive measures such as lockdown, shelter in place, stay-at-home orders to contain the pandemic at a local level. You know, but there's been a lot of the political talk that this is not real, but we continue to see the deaths each and every day, and just, you know, the responses that we're getting from the authority and many authorities across the United States really not taking heed that this is real, you know, that this science, this disease is impacting families, and it's impacting not just families, but it's impacting many entities that makes our world thrive each and every day. And it's my belief we could have done more to really slow the spread of this particular virus. You know, as again, COVID-19, it's affected thousands of people who are either sick or being killed due to the spread. And the most common symptom of this virus is, you know, our infections are fevers and cold and cough and bone pain and breathing problems that's often leading to pneumonia. This new viral disease is affecting humans for the first time. It's rapidly spreading each and every day. And it's my hope that if you feel a symptom at an early age, go and get a COVID test. If there's a cough, COVID tests are free. They are free if you lack health insurance, but if you do have health insurance, you do not have to pay a copay, and your insurance will be billed. The impact on Arkansas and COVID-19, and I look at this from 3 different factors. I look at it from a healthcare perspective, I look at it from an economic perspective, as well as a social perspective. And this COVID-19 is impacting our daily lives, and it's, you know, reaching different consequences. When you think about healthcare, just the impact on healthcare, every day you're reading in the news the lack of beds or ICU units being full. That's having an impact because of the healthcare workers and the stress that we're placing on them. The challenges with actually diagnosing appropriately and within a timely manner, you know, and the quarantine of the many different confirmed cases, patients with other diseases and other health problems that do test positive, the overload on doctors and other healthcare professionals who are actually at risk themselves, the requirement for a higher protection, and the disruption of medical supply chain, meaning most people didn't understand when they heard the word PPE. Everyone was saying, well, what out of PPE, protective personal equipment that our healthcare providers actually put on. A lot of that, those supplies were actually still at the port, the Los Angeles port, actually coming in from China. And so when I think about healthcare, and regardless of, and I make no apology about what I say, but I blame this on so many of our jobs going away when we could actually produce such supplies here. And it's my hope that we will bring jobs back to the US instead of sending jobs abroad that's actually making the materials that we need here for our different industries. But there was a major disruption within the medical supply chain here, and just the time that it was taken and the price gouging for PPE was very real. The social impact, we are by nature, we're creatures of habit, and we like to socialize. And we love to get out and be out and do things. And so COVID has impacted us socially as well. The cancellation and the postponement of large scale jobs. I'm sure we have some Razorback fans here and just on that's participating. And we notice how, the reduction of size at the games, or just the traveling, how a lot of us would actually travel. For work, I would constantly travel back and forth to DC. But that has been cut. The disruption of celebrations of culture and religious. And just for me, I miss being in fellowship. I know fellowship is any and everywhere, and fellowship is actually what you make it. And the virtual has taken over, but it's nothing like being in fellowship with other worshipers. And so just that, whether it's a Wednesday night or Sunday, it's just like your medicine, and just that meditation and preparation that you do together collectively as a whole when you're in his place, in his temple, within his church. Yeah, again, you can fellowship in your home, but it's nothing like being in that sanctuary. So COVID has really impacted that from a social aspect. The undue stress among the different populations. A lot of us were not sleeping. It is very hard to turn it off. COVID has impacted us mentally, just because we can't, be with our peers and our family members and our loved ones to really socialize and sit on the couch and just have conversation. The closures of hotels and restaurants and religious places. Also the closure of entertainment places like movies and, back during the summer, gymnasiums and swimming pools and just so on. So just from that perspective, COVID has impacted us from a social perspective. Arkansan, we are touchy-feely, warm, embracing individuals. That's a part of Milo's hierarchy of needs. So it's impacted us from a social perspective. Economic perspective, mass layoffs, closures. When I think about this, I think about our boutique type restaurants, not your major chain. Yeah, we've had some major chains, but I think about your mom and pop restaurants or entities or businesses that have had to do layoffs or closure or reduction in force. And, just the first is just that. And just the second is the risk of closures and just the negative associated with the expected length of this crisis and how it's really impacting that business industry. And the fourth is majority of the businesses have actually had to seek funding from the CARES Act, but that really wasn't enough to actually help with the mass layoffs. And as we think about it, and as we think about vulnerable populations, how many people have or had enough money in reserve that were laid off or their company closed to be able to maintain and live? So it's impacted them from an economic perspective. And I think about renters and renters not being able to pay their rent. It's impacted them just as well. For mothers or families not really being able to put food on the table, that's had an impact. And when I say food on the table, most of us that go to the grocery store, we notice the price of food increasing. It's increased tremendous. So when you start thinking about a gallon of milk or just even meat, beef, pork, or whatever you may like to cook, it increased between $1 and $1.50. That impacted the economics of households. So again, COVID's impacted healthcare, social, and the economics. And then when you start really thinking about the impact, you think about the marginalized populations. And when I think about marginalized populations, I think about rural communities. And I think about the lack of resources that actually exist within rural communities. And who's actually living in a rural community? Most people or young folks, they've deserted a rural community to move to an urban city or a larger city. But when you think about rural communities, they face a unique set of challenges in the face of COVID-19. They're often associated, already impacted in those communities by poverty, lower level of access to healthcare services, low levels of health literacy, and the social stigma. And many of those elements contribute to the problems of declining population, jobs going abroad. When I think about just the economic, I think about logging trucks and traveling South Arkansas and not being able to see the logging trucks because those jobs have gone abroad. And so we no longer have the jobs in rural communities. I think about the shortage of primary care providers and other healthcare services or professionals that impact marginalized populations. I think about our older population, poor and underinsured residents, and higher rate of chronic illnesses for marginalized populations. And marginalized populations, it's rural and low income communities, it's Black communities, it's Native American communities, it's Latinx communities, it's Native and Pacific Islander communities, it's pregnant women and mothers, immigrant and refugees, LGBT communities, and again, pregnant mothers. And I just want to pause for a few minutes, and I want you to think about just COVID-19 and pregnant mothers, mothers that have given birth, not really been able to breastfeed because of the fear of COVID, or them actually being positive and passing COVID on to them, and to mothers that actually live in rural communities and the impact of COVID. And then you think about the lack of really the public health attention that's needed for COVID-19. We never really heard the word public health into COVID-19, but public health just didn't start just now. See, back years ago, there was the smallpox, so pandemic. Smallpox, very similar to what's going on with COVID-19, impacted so many. The time frame was years for smallpox. Then there was that development of a vaccine, but it's very similar to what we're seeing now pertaining to COVID-19. And most people don't think about other diseases that have required vaccine, but there's a history, and there's a history that people don't think about, but it's because of public health that most of us received vaccines, or vaccination was because of public health. And what is public health? Public health promotes and protects the health of people in the communities where they live, learn, work, and play. While doctors treat people who are sick, those of us working in public health try to prevent people from getting sick or injured in the first place. We also try to promote wellness by encouraging healthy behaviors. People in the public health work field actually assure the conditions in which people can be healthy. That means vaccinating children or adults, to prevent the spread of disease, or educating people about the risk of like alcohol or tobacco use, setting public health standards like the seatbelt. I remember as a kid growing up, you could just get in the car and you didn't have to have a seatbelt. But it wasn't until public health made it an issue and passed laws in order to protect us that we had to actually start wearing seatbelts. I remember my teachers could smoke. There were smoking areas for teachers as well as students, and students would actually go outside. But it's when public health started looking at the cancer rate, and there was a correlation of cancer rate and smoking. Public health sets the safety standards to protect workers and develop school nutrition programs to ensure kids have access to healthy food. Public health is so critical to us and for us. Public health actually helps to track disease outbreaks and prevent entries, and shed light on why some of us are more likely to suffer from poor health than others. Let me stop right here just for a few minutes. Some of us are more likely to suffer from poor health than others. I explained to you that my father tested positive. The grandkids tested positive. My father has other chronic diseases. So he should actually be in a hospital bed. But because of me and just having the financial resources, our diet and the supplements that we take each and every day. And I'm one of those that believe in herbals. And when I say herbals, if it's turmeric, if it's, we all need to take a tablespoon of honey. This was before COVID, and just making sure that this was a part of our regular diet. And I say this why some people suffer from poor health outcomes compared to others, because we had the financial resources to be able to buy supplements, be able to buy vitamins way before COVID. Knowing the importance of drinking water and not having soda or Coke, and having tea or things that are healthy, and making sure that we eat enough fruits and vegetables on a daily basis. But some are not as fortunate. Many facets of public health include speaking out for laws to protect many different problems that actually impact us today. And as we think about that and think about public health, and now COVID, and now we have 2 vaccines, one from Moderna and one developed by Pfizer, and then Johnson & Johnson actually has this second that's being approved. But there's a challenge with the vaccine distribution. There's a challenge because we can't be an American when a whole segment of our nation has no trust in America. Right now, there is distrust in our government system. There is distrust among people that we even talk to about the COVID vaccine. There is distrust in our nation. The challenges with the vaccine distribution, many people are overjoyed and can't wait to get their first shot. But there's still a lot of people are still skeptical about this vaccine, especially in the first quarter. There's a lot of skeptical folks, especially in the African American community, where there remains a distrust and the high resistancy that has spread it through different racial groups, especially people who live in rural communities. And I say that because the government has not done a very good job of simplifying a message that resonates with people that live in rural communities. You cannot have the same message for individuals that live in urban communities versus individuals that live in rural communities. You don't sometimes necessarily have the same resources just based on geographics. There's just a lack of confidence in people. And just the data illustrates how social determinants of health, disparities in education, economics, and our social standing plays a major factor when public health specialists try to help vulnerable populations with messaging. And some of the vulnerable population that have been hit the hardest with this pandemic, they can't create a message or articulate the words to make them understand the importance of taking this vaccine. How I see this vaccine, COVID is here to stay. COVID is just like, it's not going away. Just like we get our flu shot, we better be prepared to start receiving a COVID vaccine on an annual basis. Most people think, it's a hoax. COVID-19 is a hoax, and they don't want to wear masks, but that's not so. And then as you start thinking about the challenges with the vaccine distribution or the challenges with COVID, it's actually hard to social distance by 6 feet when you have so many of your marginalized populations living in a multiple generational household. How can we really enforce social distancing? And I'm saying we, as healthcare leaders, as public health workers, how can we really articulate and say, you need to remain 6 feet apart? That's difficult for some marginalized populations. So we need to think about our messaging as we're crafting messages. And we need to be mindful and put ourselves in individual shoes in order to get them to understand the significance of this pandemic and what they can do from a practical perspective. And again, the public health messaging, one size doesn't fit all. And it's a challenge, I recognize, to create an effective preventive related messaging when targeting groups to dismiss such warning, believing that their risk to be low. It's going to take all of us to really help educate individuals about COVID and just the importance on actually receiving the vaccine. The vaccine is because we trust in science. And as Christians, we trust in science because we have that faith, and we believe that individuals were given the tools and the knowledge and the skill set from the man up above to be able to make such vaccine. This vaccine will only help to save lives. Yes, there may be some long-term side effects. We don't know, but that's science. But we can be rest assured that people will be studying because of the talent that God has given them to be able to really look at COVID-19. And as I come to a close, please remember how we should respond and how we should respond to others as believers, as Christians. We can't panic. God is in control, and we have to be wise, and we have to take reasonable steps to avoid exposure. And he wants us to be wise. Exposure to the disease to protect and provide for our family. And third, we have to look for opportunities to bring people closer to God, to be bold and to be compassionate in sharing his word and always speaking the truth about love, the truth about love and the truth about the Bible. The Bible is the word, and that Bible was prepared for us many years ago as that teaching, as that preparation. And just like we are reading any other magazine, any other book, it's already written. And the Bible speaks of science and faith. It's just a matter of us taking heed and being practitioners of his word. As I close, for those that are listening or just watching, please be mindful to wash your hands with soap. If soap is not available, to use alcohol-based hand sanitizer. Avoid close contact with people who are sick. Stay at home when you're sick. Practice social distancing. Clean and disinfect frequently. Touch objects and surfaces that you may touch. Mr. Jeffrey, now it's time for open discussion.
Okay, there we go. I'm sorry, I was having trouble with both trackpad and mouse, but I think I'm unmuted now.
That's okay.
So let's see, what I'd like us to do, if we could, we'd welcome your questions. And so if what you could do is either you can enter a question through chat and the group will see it and I'll try to read it for us. Or Kenneth, can you unmute now?
Yes.
Okay, so can people unmute themselves and ask a question?
Yes, they should be able to. You can click the little unmute button.
So thank you to LaShannon, and questions that people have.
And as people are formulating questions, I just want to thank Dr. Susan Robbins. Dr. Robbins is very special and dear to my heart. She is my daughter's piano teacher. And I am always thinking about her health and her wellness. She actually teaches piano lessons for students at Pulaski Heights United Methodist Church here in Little Rock. So Dr. Robbins, thank you for listening tonight as well.
Questions?
That means that I didn't really get into it. If there are no questions, I can go back and I can start all back over.
Hang on, Scott Monroe is texting a question here. Let's see if I can get the full one. How do you respond to the people who ask about whether people are dying from COVID as opposed to dying with COVID.
Wow. Dying
I think
of
you might be
and
here, folks trying to minimize the death statistic. Would that be right, Scott?
Yes, we just had a letter like that in our local newspaper today, and I think I think there's some attempt to think that these statistics are being inflated because if COVID is a factor, people may be thinking that these are not necessarily deaths that we should be as concerned about.
Mr. Scott, I actually questioned that as well, because I actually question some of the CDC numbers that's actually being reported also. And I say that from the vaccine distribution, because right now, if you go on CDC's website, they'll have Arkansas at the bottom 50. Well, that's not accurate information. So I question the accuracy of a lot of data, and especially just going on a death certificate, died with COVID. Is that just the easy route out? Or they died with COVID? So we need to be very mindful of people that are just healthcare practitioners, what we're writing on those death certificates for the reason people are leaving us on Earth. Does that answer your question, Mr. Scott?
It gives me some good insight, because I've wondered whether this was a valid question to ask or whether it's perhaps somehow politically motivated.
I question that. I'm a very transparent person, so please, I want anyone to please feel free to ask any question. I question, is that the easiest thing to check off right now? Because this is the time that we're living in, when it was really a heart attack, or it was really because of renal failure, or it was really because of something else. And exactly what you stated within your question, was it because renal failure with COVID, cancer with COVID, or Alzheimer's with COVID? But unfortunately, because we're living in this time right now, this season, we're just gonna have to trust and believe. And that's sort of rather difficult right now. But trust and believe we will know what has transpired when so many people died of COVID or with COVID. We'll know in years to come.
So would I be right in saying we might recognize that we're still struggling to get accurate statistics out there, but we would recognize that but not minimize the pandemic? Would that be a fair response to what you're saying?
Yes, sir, it would definitely be a fair response.
So you wouldn't, the thing I think, Scott, you were picking up on is you wouldn't use statistics or you wouldn't use questioning statistics to try to minimize that in any way, because the pandemic is the pandemic, just recognizing that we're still struggling with accurate reporting. Other questions?
When we talked about just the challenges, the reporting of the data is a challenge within itself. From a public health perspective, we have not done a very good job of reporting such information to the general public. This is all new. This is coming so fast that we as government just not prepared.
Susan Robbins, I think you know her, asks, what have been the effects of the COVID pandemic on children is there more depression or other psychological problems?
There's definitely more depression. Thank God for our psychiatrists, psychologists, and mental health therapists. COVID is really impacting children from a perspective of really not being able to socialize like they used to. And now kids are in the house a lot more compared to going outside. So there's been an uptick, and medical professionals that have that specialty in mental health that are seeing more kids via telehealth. There's been an uptick in mental health and just a depression.
Well, Susan, a follow-up question at all? That was a pretty blunt answer.
And I'll have to just say, Zoe Olivia is the only child. And I tried at the beginning of homeschooling, just trying to make her be in a little cocoon, but it didn't work because I started seeing patterns of her, but not just her demeanor and depression and not being able to see her friends, even though her school put every single measure in place, in temperature and mask, and making sure that the desks were 6 feet apart. I was still concerned, but I needed to send her back to school in a classroom so she can have that social interaction with her classmates. I noticed some different triggers within her demeanor, and just she appeared to be sad, and she was actually looking at a screen and not connected to school, even though she was doing her work. There was just still no connection. And so after 2 weeks, I knew she had to go back into the classroom.
So the community health center, you're managing clinics across the state.
Mm-hmm.
Just share with us a little bit. You've raised a lot of concern about targeting messages to different communities and trying to communicate in a way that we can be heard. So I'd just be interested in some of the things that you've done through CH Community Health Centers of Arkansas in terms of outreach, communication, any thoughts you have to share just as a practitioner.
Faith-based leaders. Faith-based leaders are so key to this equation. Faith-based leaders and also community leaders. That community leader in Fort Smith, having been on a commercial, is not going to be as impactful for folks that are down in Texarkana and Miller County compared to Sebastian County. We have to ensure that we have local leaders that are trusted, that can help be our messenger to promote the vaccine. Over in East Arkansas, there's Dr. Susan Ward Jones, MD. She actually showed individuals getting the vaccine. She was able to really articulate the significance and the importance of being vaccinated and the herd immunity and how we all should be vaccinated. They're going to listen to her being that practitioner in the community compared to a doctor that's in the Little Rock community. Messaging from key community leaders is very important.
So that means, and again, just this was part of, I think, the message you brought in, but the importance of the church as well in terms of appreciating the gift of healthcare and promoting trust in it.
Absolutely. And just the gift of healthcare being just that science.
Mm-hmm.
And, Genesis, in the beginning, Genesis talk about in the beginning, God created the heaven and earth. And it's just in that beginning, and it's absolutely faith-based leaders. The church has to be a messenger. The church has to be a part of the equation in ensuring and eliminating any stigma people may have pertaining to this vaccine. This is the time we really need all of our churches, regardless of denomination, religion, to help amplify the message.
That's a good, healthy challenge for those of us watching this evening. Other questions, Kenneth? Are there any questions through Facebook?
No, I don't have any here.
Okay. Just other responses or questions from those of us who are listening. Hang on. Okay, this is from Margaret McCullough. UAMS has reported that UAMS workers were taking the vaccine at a rate of about 70%. Have you seen any percentages of the Arkansans who are willing to get the vaccine?
I have. Let me speak to first, Ms. Margaret. Your statement was pertaining to UAMS and that 70%. They have an outstanding chancellor that has been the messenger in educating, and his executive leadership on the importance of being vaccinated. But there are still some healthcare workers that are hesitant about taking the vaccine because people are saying, oh, it takes at least 10 years to make a vaccine, and this vaccine was rushed. Times have changed. Technology has changed. Technology is now at just the speed of technology changing. So therefore, the speed of a vaccine has changed as well. And as we think about history and the last time there was such pandemic, it's because we didn't have technology and different systems that we have today. And just the artificial intelligence and just so much of the science we have today, we didn't have it years ago. And so when people say, oh, but it just too soon, things have changed. UAMS, again, great chancellor. He has been really articulating the importance, but for some of our hospitals, and I will say for some community health centers, there's some hesitancy about taking the vaccine. And it really depends on geographical location. And it depends on who is the messenger. And the buy-in, the importance of the buy-in just as well. So Ms. Margaret, I hope that answers your question.
So actually, and I think you're in a position to speak to this. I'm going to first put out, this is another question from Susan Robbins. In rural communities, are there enough deep freezers to store the Pfizer vaccine?
We're still waiting on freezers that were ordered 2 months ago. So the answer is no. We do not have the freezers to be able to store the vaccines that we need right now. We do not.
So follow up to Susan's question, that's then going to slow down our ability to vaccinate in rural areas.
That is one of the factors. Yes, ma'am. That is correct.
I'm adjunct faculty at at UAFS, and I will be 65 in April, which I think puts me squarely in category 1B. Am I right?
Yes, sir. And you should have received notification that this week that you should sign up to be on the list to be vaccinated.
So behind that is a question, are we experiencing confusion in terms of getting the word out there and who should be vaccinated and who should sign up and when and that sort of thing?
I think the confusion, not that I think, the confusion lies in the number of dosage that we actually have in our state. Last week, our state only received less than 50,000 vaccines statewide. So when you think about 50,000, that's basically 500, estimate give or take 500 per county. So now we have the category of 1B. That's our educators. Do we have enough vaccines in our state on 1/19/2021? Mr. Jeffrey, no, sir, we do not. Have we failed individuals like you? Yes, we have. Because the lack of planning and preparation and ordering and getting this, it's a supply and a demand issue for the state of Arkansas. So from a reality perspective, 2 months before every educator, K through 12, higher ed, could potentially receive the COVID-19 vaccine. 2 months. And that's just being truthful to you because of supply and demand. And I think what's so often instead of people being politically correct, if we could just really articulate this is the issue, people will be a lot more understanding than us actually overpromising.
I want to thank you personally for that. That was helpful. And then we have another follow-up question from Susan, which is, I suppose, in contrast to the Pfizer vaccine, can you request the Moderna vaccine?
No, ma'am. And it's, again, supply and demand. And our state may receive more Pfizer than Moderna. It's just what the federal government actually sends to the state.
Other questions? Just give a moment here.
Well, again, Mr. Jeffrey and Miss Pat, I really want to thank you for the opportunity to be with St. John's tonight. I'm grateful, and whatever I can do for your congregation, please do not hesitate to contact me.
Very good. Well, this has been illuminating and at a couple of points sobering. But I think I will be calling and making my reservation, understanding that I have to wait. I'm leaving it hanging for a minute or so here, but I think we've fielded the questions that people have. So hang on. Mike Lager wants to thank you for your honesty tonight.
You're welcome.
Mike is the rector of St. John's, by the way, so we're actually meeting with his blessing through his authority. So he thanks you for your honesty tonight.
Well, thank you for allowing me to be here and to be honest.
And I guess okay, you already answered this one. You already spoke about reaching out in different communities and the importance of local leadership. So you already spoke to that question for me. That was one that your thing raised. And another many thanks to you for sharing your broad experience.
You're welcome. But again, if you are a servant and you're trying, you have to share your testimony to prevent others potentially from making or being more cognitive.
And on that note, I think I'm sort of MC here. So we'll start saying good night, and people can just, I imagine we'll just start logging off the meeting. And again, LaShannon, thank you so much for being willing to share your time with us this evening. And
Thank you for having
your
me.
skill and knowledge.
Thank you, sir.
Yeah. Good night, all.
Thank you, Mike.